All right, we're going to put on the mask. This particular mask type is called a nasal pillow. It's the mask that just goes underneath the nares of your nose, and Art's going to help me put that on. Okay, so this could be one of the options while you do the second night study of what they're going to put on you. So it fits underneath like that.
That's correct. So it just has to fill the nair and seal the nair so that pressure is maintained in your airway.
And this is the point where you usually bring your cell phone video camera and phone. You take a picture at this point, and you post it on Facebook if you want. This is the way you would sleep if you are having a nasal pillow mask, and eventually they turn on the machine and they titrate you throughout the night. As air goes through your nose, you're breathing only through your nose, and out through your nose. It takes a little getting used to. Okay, now we're going to try a nasal mask. This is usually the in-between mask for a lot of the labs that they use during sleep studies. Sometimes, if you were to use the nasal pillows, it does irritate certain patients, just not being comfortable with having something directly in your nose. So the nasal mask covers the entire nose, still leaving your mouth open, and it's just based on comfort, and again, whatever your lab will be using and what your sleep technician is going to recommend. Okay, so Art's going to pop on the nasal mask on me, and you can see how this fits. It is comfortable. They have many different styles, many different brands, many different makes and models, but they all pretty much do the same thing as far as just covering up your nose. You do have different sizes.
The biggest thing we don't want to do is over tighten the mask. It should be tight enough that the mask does not leak,
Excellent.
but not tight enough to leave rings.
Good. You feel the air coming. And again, it takes a little bit of getting used to, but you're breathing in and out through your nose. Okay, and last but not least is the full face mask. Now, here's the reason you would have to use a full face mask, whether it's in the sleep lab or eventually if you get scripted for something to use at home. The full face mask covers the nose and the mouth, and this is for those mouth breathers where whether a chin strap can help or not. Allergy sufferers, it is a phenomenal tool for the technician to be able to get a really accurate titration study for that night. Okay, so it's going to cover the nose, it's going to cover the mouth, and many different brands, many different models. It's just so you have an idea. Okay.
The main idea is to maintain that pressure to the airway.
Excellent. So via the nose and the mouth.
Great. Here we go. Transformation to Darth Vader.
And you can feel the air coming in, so it's really good. So, good night.